Hi, my name is Morgan Brown, and I'm the Executive Director of Montaña de Luz, an organization serving children and families affected by HIV/AIDS in Honduras. I'd like to tell you just a little bit about our year and about the impact we're having on the ground in Honduras and the vision for the future of Montaña de Luz. If our mission and our work resonates with you, please give during the Winter Appeal, which is hitting mailboxes this week, or you can give online at montañadeluz.org/give. As many of you know, Montaña de Luz started 17 years ago as a hospice for children affected by HIV. In those days, there was no antiretroviral treatment, meaning that HIV was truly a death sentence for individuals in Honduras. Honduras has about 17% of the population of Central America, yet 60% of the HIV cases. So it was truly impacting the population at that time. And Montaña de Luz was formed to be a hospice, a loving place for children to live out their days in peace. But luckily in 2003, the UN Global Fund made a commitment to Central America, and Montaña de Luz gained access to antiretroviral treatment. This changed everything. Our kids were able to not only live, but if they took their medication properly, to grow and to thrive. And Montaña de Luz was able to shift from being a hospice to a loving home. Since 2003, we've been providing comprehensive care to our kids. They're enrolled in school, they receive antiretroviral treatment, they get loving care from our nurses and our caregivers who support them 24/7. They receive trainings from our psychologists to equip them to confront their condition. They even can be involved in Charla Luz, which means light talks, and it's a presentation we do out in communities, and our kids can be leaders in that and to reduce stigma and to talk about prevention of HIV. And they gain life skills like cooking and budgeting and taking a bus, and even have the opportunity to move to Casa Luz, which is our transition program, and to eventually transition into independent living. So we do everything we can to prepare our kids to live in what is still a really harsh reality in Honduras, one of poverty, limited economic opportunity, and still a lot of stigma against HIV. This year has been amazing for some of our kids. Diana got into Ciotec, which is a private university in Tegucigalpa. She's been taking classes there. Nicole just graduated high school. And Tato graduated from our homeschool program back into the public schools. And for those of you who don't know about our homeschool program, Honduras does not have a really strong itinerant services in their public schools and support services for children with special needs. And so we took on many of the kids at our homeschool program a few years ago, and so we prepare them through more individualized education. Tato graduated from that program back into the public schools, so that's a really awesome accomplishment. Of course, many of our kids still face significant challenges brought about by HIV, including struggling in school, struggling to concentrate, behavioral issues, and just general longing to be with their family, which is not always possible for each individual child. It's not possible for them to reintegrate right away with their family. It is so important that you give to Montaña de Luz during the Winter Appeal. First and foremost, our kids need your support. They need funds for transportation to their medical appointments, for food, for clothing, for school fees. They need you to support them for 2018. We need your support to maintain the loving, supportive structure that we give to our children 24/7 with our staff in Honduras. But at Montaña de Luz, we're also building for the future, one in which we can serve in new and exciting ways, and we can have more success stories like Diana's and Nicole's and Tato's. In 2018, we will serve 30 additional families. This is really exciting. It's twice the number that we currently serve. And we're able to do that by expanding our home visiting services. So I'll tell you a little bit more about that. In Honduras, there's a whole generation of young adults who have been greatly affected by HIV, and this is Diana's and Tato's and Nicole's generation. There are estimates that there are about 26,000 young adults in Honduras ages 15 to 26 who do not have adequate access to HIV support services. These young adults are now having their own children and building their own families, which is a great thing. However, only 42% of individuals in Honduras living with HIV are adherent to their antiretroviral medication, meaning that HIV can still spread, especially among vulnerable communities. And many times barriers for young adults in Honduras are very similar to barriers for lower income residents here in the United States. And they include things like working a long day, a 12-hour day, and not having time to go to medical appointments, or not having reliable transportation. Sometimes it's the stigma of HIV, so walking past other people in the hospital to go up to the floor to receive care is sometimes very stigmatizing, and so people don't continue their medical appointments. Sometimes it's difficult to adhere to antiretroviral treatments because it's a long-term commitment. It's a commitment for the rest of their lives, and so sometimes that's very difficult to do. Sometimes additional medication is needed, so there are complications of HIV that cause other health conditions, and those medications are not always supported by the government, so it's too expensive for families to pay. And sometimes families just don't have an advocate. They don't have someone to support them if the hospital and the clinic are not providing the support that they need. Having said that, the hospitals and the clinics do as much as they possibly can. They're working hard. The problem is that they just don't have the funds to get out into communities, especially vulnerable communities, and make sure that families eliminate barriers to receive all the care that they need to remain adherent to their medication. In the past, families have had to give up their children to the orphanage system due to these barriers to care. And that's just not good enough, and it's not a system that is well functioning. And at Montaña de Luz, we want to address these barriers to care and keep families together before they're torn apart, provide the specialized services that they need to address their barriers to care. So by working with vulnerable families, we're also able to provide services for a fifth of the cost of raising a child on the mountain at Montaña de Luz. So we'll be able to serve 5 times as many children and make your dollars create even more of an impact in Honduras. And you'll be contributing towards creating stable family units, and not just towards a child, but to a family unit. And that creates an automatically stronger support system for that child, a stronger support system anchored in a community that is also supportive, and we eventually begin to break down HIV in Honduras. So this year we'll go outside our walls to double our home visiting services, but long term, we hope to serve hundreds of children in Honduras and maybe potentially have an office in Tegucigalpa so that we can do these home visits throughout Tegucigalpa. And so we're really excited about this mission, and we hope that you'll be a part of this in the years to come. We actually have already started some of the home visiting, and our first case was a family in Villa de San Francisco, which is right down the road from Montaña de Luz, and the story is in the Winter Appeal. So take a look at that, and if you haven't received the Winter Appeal or you're not on our mailing list, just email us at info@montañadeluz.org, and we'd be happy to send you a copy. And also, if you don't get the appeal but you want to give, please give at montañadeluz.org/give. Every dollar is important, and it'll go towards helping these children in Honduras. And thank you so much for watching this video and for supporting our organization, and I hope to hear from you in the weeks and months ahead. Thank you so much.